Hi everyone. So this week we are talking about the pathophysiological changes that occur with STEMIs and why time as muscle is important. So as we know, in a STEMI, the coronary artery is blocked off by a blood clot, and as a result, virtually all of the heart muscle that's being supplied is affected and starts to die. This is a very severe type of heart attack. It's usually recognized by the characteristic changes it produces on the ECG, and that one is the ST segment elevated, and relatively large amounts of the heart muscle are damaged. Nearly 70% of all heart attacks are classified as STEMIs. The most common triggering event is the disruption of plaque in a coronary artery, which leads to a clotting cascade, sometimes resulting in total occlusion of the artery. Atherosclerosis, as we know, is a gradual buildup of cholesterol in fibrous tissue and plaques in the walls of the arteries, and this usually occurs typically over decades from people not modifying their lifestyle. And so the plaque can become unstable, it ruptures. Additionally, it promotes a thrombus that occludes the artery, and it can occur within minutes. When a severe enough plaque ruptures in the coronary artery vasculature, it leads to myocardial infarction, which is the necrosis of downstream myocardium. In a STEMI, the coronary artery is completely blocked off by a blood clot, and as a result, virtually all the heart muscle being supplied is affected. And also an inferior wall MI may also occur because of the occlusion of the right coronary artery, and it usually occurs alone or with a lateral wall or right ventricular infarction. If impaired blood flow to the heart lasts long enough and there's an imbalance in the myocardial oxygen supply and demand, it triggers a process called the ischemic cascade, causing cellular injury, and eventually the heart cells in that territory of the occluded artery die through necrosis, and they don't grow back. So time as muscle is so important at this point. When the disruption of blood flow has occurred, we must establish an adequate oxygen supply to the myocardium as well as to the other tissues to help stop any further damage to the heart muscle. And patients may undergo angioplasty if it's within 12 hours of their MI, and sometimes they receive stent placement in the coronary artery, or thrombolytic therapy may be given to break up the clot if given within 3 hours of the attack. Treatment includes nitroglycerin or morphine for pain, and sometimes they receive aspirin if it's deemed safe. Aftercare for MI patients include maintenance medications such as ADP receptor blockers like Plavix, anticoagulants, beta blockers, nitrates, ACE inhibitors, or glycoprotein inhibitors, or aspirin, and of course recommended modifiable lifestyle changes.